Yeah, good, so.
All right.
Good morning, class. My name is Chris, and today we're going to be talking about physician-assisted suicide. Some little context on what physician-assisted suicide is. Physician-assisted suicide is when a physician facilitates a patient's death by providing the necessary means and information to enable the patient to perform the life-ending act. An example, the physician provides sleeping pills and information about the lethal dose. The distinction between physician-assisted suicide and euthanasia is that with euthanasia, the lethal dose is administered by someone other than the patient. So if the physician administers the lethal dose, it's euthanasia. Our proposition is for physician-assisted suicide needs to be legalized in all 50 states to protect people's individual rights. The significance claim is that there are strict guidelines and regulations that exist and are in place that prevent anyone from just walking into a hospital and requesting physician-assisted suicide. There is a specific criteria that individuals need to meet before requesting this. Patients need to meet the following criteria, and it goes as follows. You need to be at least 18 years of age or older, capable of making and communicating healthcare decisions for him or herself, diagnosed with a terminal illness with only 6 months to live, 2 oral requests by the patient 15 days apart, a written request by the patient signed by 2 witnesses, confirmation of diagnosis and prognosis by the attending doctor and consulting physician. The patient must be informed of feasible alternatives as well. The physician may prescribe the medicine to the patient, but it is ultimately the patient's choice if they want to end their life or not. The physician only gives them the chance to choose what they feel is best for themselves because it is their life, so let them decide what they want to do with it. The inherency is, in the case of Washington versus Glucksberg, the Supreme Court ruled that the Due Process Clause of the 14th Amendment does not guarantee an individual the right to physician-assisted suicide. The court ruled that since the individual states can have legitimate interest in prohibiting physician-assisted suicide, the ruling made it clear that legalizing or criminalizing it, physician-assisted suicide, was a matter of state rights. The solvency claim is that this case is from 1997. It's more than 20 years ago. It's as old as me. We need to have the Supreme Court reconsider this case and take into account the suffering, the pain, and the unnecessary expenses that individuals carry throughout the rest of their lives in hospitals. If an individual chooses to leave peacefully, then why not give them the right? It's their body, it's their choice, it's their right.